We have a very special show in store for you today. In honor of Heart Month, we are joined by the best of the best in cardiac care.
That's right, world-renowned, and one of our own, Dr. Mark Gillinoff, has picked some of the best and brightest Cleveland Clinic caregivers to give us life-saving information.
So we're talking about heart health, we're talking about COVID, we're talking about healthy food hacks, and of course, we always have a little bit of fun on this show, so we'll have some of that as well. Make sure you join us right now for New Day Cleveland's Love Your Heart show. It starts now.
Welcome to New Day Cleveland's Love Your Heart special. That's right, Dr. Mark, always so good to see you. We're excited to have you for a whole hour today.
There he is. We're going to start off with the big question, some big information that's out there right now. So the Cleveland Clinic did the survey of one of the things that they found is that people aren't taking medication. So Dr. Mark, I mean, that is a big question. That's a big concern. Why are they not doing so?
I think people have put COVID-19 appropriately at the top of their list of health concerns and health problems. And of course, from a societal perspective, it's at the top of our list. But what people have to remember is just because we've got COVID-19, other issues haven't gone away and they can be festering beneath the surface. So we're all concerned about avoiding getting COVID-19, obtaining vaccinations, not infecting family members. But at the same time, we've got to take care of our high blood pressure and our high cholesterol and our previous cardiovascular disease. Don't skip those doctor's appointments. Don't forget to refill prescriptions, because once we get this pandemic completely under control, we're going to have to remember we've got these other problems and we don't want them to have become worse while we were dealing with the pandemic.
You know, it's almost like a house that's got a whole bunch of doors. You know, we're worried about COVID-19, so we lock the front door to keep that out, but we get all these other doors open and almost anything else could get us there. I mean, there's the common cold, there's all kinds of different symptoms and things. What are some of the symptoms that people are missing right now that they should be going to the doctor?
Well, they're all the usual things. COVID-19 hasn't really changed too much with heart health, except that people who have cardiovascular disease are more susceptible to complications. But if you're getting the #1 symptom of cardiac problems, chest pain that feels like pressure, or chest and arm pain, or pain up the left side of your neck, those can be signs of a heart attack. We're seeing people come in late with heart attacks. People can also get aortic problems, aneurysms, which can cause abdominal pain and also back and chest pain. We see them presenting late as well. People are really afraid to go to the hospital. And what's scarier is not going to the hospital when you've got a problem. The hospital is extremely safe. Our ERs and our floors and our clinics, everyone is screened, there's social distancing, there's masking, there's more Purell hand wash than you can find anywhere else, certainly more here than the supermarket. So if you are feeling symptoms, get to the doctor right away.
Dr. Mark, and all the patients you see, I know within this past year, I mean, you deal with so many. Are there any patients that maybe stood out to you, or things that were said to you from them as to why they didn't come in, or why they were afraid to, that you then had to have those talks with them and say, this could have been solved had maybe we done things differently?
Yes, we've seen some people with aortic problems, what's called an aortic dissection, which is a tear in the aorta. That's a real emergency. Someone gets a partial tear in this large artery in the chest, and we want to operate immediately before it becomes a complete tear, because once it becomes a complete tear, game over. We can't do anything. And we had someone recently who came in just on the verge of actually dying from it, but this had been going on for 3 days. So he was incredibly lucky that he survived. Maybe another hour, half day, and it would have been too late to operate. And after surgery, we rushed him to the operating room and literally saved his life. After surgery and talking to him, we said, well, how long was this going on? 3 days. Why didn't you come to the hospital? Well, I was afraid. And the bigger thing to be afraid of wasn't the hospital and other people and COVID-19. The big thing to be afraid of was he had a true life-threatening problem right here in his chest. And another hour, who knows?
So we talk a lot about going to the hospital, you feel these symptoms and you should go, but we were talking in the beginning about why do people put off taking medications? Why in the world would somebody like slow down their medications? Are they trying to save their pill stash, or are they afraid to take the medication? What causes that?
Actually, it's a fear of encountering other people and getting refills. Sometimes to get a refill, you might have to go to the doctor. Maybe the doctor wants to see you to see, do I need to adjust your antihypertensive or your medicine for your heart? So I want to see you, get a blood pressure reading, and people are perhaps afraid to go to the doctor's office. Then the second issue is you've actually got to go to a pharmacy in many cases to pick up the prescription. And we've seen people say, I'm not leaving the house and I'll just go without it because I feel fine. Well, the thing about something like high blood pressure, you don't feel anything until you experience a stroke or a heart attack or an aortic problem.
Wow.
So when you do feel something from high blood pressure, and I keep choosing high blood pressure because it's so prevalent, when you feel something, it's a little bit late. Again, you put your mask on. I'm pleased to see everyone wearing a mask these days. I've been wearing one for the last 25 years. No problem with that. We all look like surgeons these days. That's kind of cool, right?
Right?
We all look like surgeons on TV.
Perfect.
Makes us all feel a little bit more intelligent, right? That we can walk around and save the world too.
I need one of those hats too.
Okay. So,
Yeah.
you know, Dr.
Yeah, I
Mark
get
is
a cool hat.
That's right.
He's such a wealth of knowledge, this man. And we know that a lot of you out there might be watching this morning and you might have some questions for him. And he, of course, always has the answers. So we would love to hear from you. You can email us your questions at newday@fox8.com. Again, newday@fox8.com. We'll be touching base with Dr. Mark all hour long, and he will get to some of those questions for you.
So much more life-saving information out there that's coming up on New Day Cleveland. And Love Your Heart. We're going to talk about broken heart syndrome and the best way to lose the pandemic 15. What is that? You will find out when you come back. So stay right there. In honor of Cleveland Clinic's centennial year, we celebrate this heart history moment. In 1956, Donald Effler performed the first successful stopped heart operation on a person. In 1968, he was the senior surgeon on one of the first heart transplants in the U.S. In July 2020, Cleveland Clinic completed its 2,000th heart and 2,000th lung transplantations. Here it is, 76% of Americans report feeling more stressed because of COVID-19, yet only 55% know that stress can have a substantial impact on heart health. This is according to a Cleveland Clinic heart survey. More interesting heart health facts throughout our show today.
Speaking of stress, so we all live with it, right? And our own heart guru, Dr. Mark, is joining us once again live at the Cleveland Clinic with information on a stress-induced condition that is called broken heart syndrome. And you know, Dr. Mark, I hear broken heart syndrome. You always hear of the phrase, you know, people die of a broken heart. And I think that always seemed like a myth to some people. But there is truth to this.
Oh, there is definitely truth to this. I mean, Shakespeare wrote about this. I believe King Lear died of a broken heart. But we're talking about something that is actually happening in real life. And I'm joined by Dr. Kalra, who's actually studied this, the broken heart syndrome, the impact of stress on the heart, and where COVID fits into this. What did you learn?
Yes, so this was a question that came up, you know, once we started observing an increase in the number of cases of broken heart syndrome we were seeing as interventional cardiologists in the cath lab. And the question was, is it just you know, run of chance, or is it because we're in the middle of a pandemic? And you know, all of us knew back you know, in March and April last year that you know, there was a social distress and economic distress and psychological distress, and we really wanted to study if the increase was, you know, like I said, just a run of chance, or was it truly related to the pandemic. And what we found was that there was a 4.5 to 5-fold increase in the number of cases of broken heart syndrome. And this was when we were in the midst of the pandemic. The pandemic had just hit the shores in the US early March. You know, that's when, I believe it was mid-March when the first case was reported in our state.
And what do these people who have broken heart syndrome feel, and what's actually happening to their hearts?
Great question, an important question. So it's a great mimicker of a heart attack. So that people will feel symptoms which are very similar to that of a heart attack. So chest pain, you know, shortness of breath, you know, could be nauseous, breaking into a sweat. And you know, just to your point that you were making before in the earlier segment, that you know, patients should not ignore what's happening to their heart conditions, you know, because the heart conditions are still here and they've not gone away just because the pandemic is here. So the important message is to come to the emergency department. Actually, once they present to the emergency department and you get the ECG, which is the 12-lead electrocardiogram, even that shows signs which are very similar to that of having a heart attack. And the only way to make a diagnosis of broken heart syndrome is to then take them to the cath lab, do the angiogram, and see if there are no blockages. That's when you sort of.
Unlike a heart attack, is this true that people with broken heart syndrome usually don't have permanent damage?
So it's an important question. I think it's an evolving question. If you look in the literature, the recurrence is not trivial. It's about 2%, 2 to 4% per year. If you accrue that incidence to a decade, it's about 10%. So it tends to recur. But like you said, it's short-lasting. There isn't permanent damage, but in the acute phase, it could be lethal. It could be a lethal condition.
Who gets it? Could a young man or woman get it, or does it tend to be your usual heart attack person who's a little bit older?
So anybody can get it. It's definitely a lot more common in postmenopausal women. It's traditionally been described more commonly in women. But what our study showed was actually it was equally prevalent, or if not more, in men also. So middle-aged men, that was the usual patient in our study. But to answer your question, typically it's postmenopausal women. I mean, if you look at the literature, 90% of it is women in postmenopausal age.
And is it still true with this, as with heart attacks, that women tend to be tougher than men in the sense that they put off going to the hospital, especially today?
That is absolutely right. They put off going to the hospital. Nobody really knows what the true incidence is or the prevalence is, precisely because of what you just mentioned and said. People tend to put these symptoms off. So maybe somebody had a broken heart syndrome while they were in the house, and they just stuffed it through and they were fine, because it is a condition that resolves in about 1 to 2 weeks if you repeat the heart ultrasound.
Well, great news that it resolves, but this is the pandemic and stress getting you right here. This is super important information for everyone to know. Try to minimize your stress, easier to say than to do, but if you do experience any symptoms related to your heart, chest pain, shortness of breath, arm and neck pain, first step, call 911. Don't wait for it to go away. Call 911. Well, back to you, David and Natalie.
Dr. Mark, I might ask you real quick then too. I mean, I know we always talk about this with you. What can people do? What are the best things for people to do to stop the stress from beginning, to relieve stress? I know you're huge on the exercise aspect of things.
Different stress relief strategies work for different people. I personally love exercise, aerobic exercise. There are now so many different apps, though, for meditation, stress relief. And I've actually listened to some of them, and some of these apps you can get for free on whatever kind of phone you've got are really, really good. But I think for me, exercise, take some time for yourself. I always thought meditation, there's no way I can learn how to do it. And actually, you can do it in little short segments. And I find it somewhat refreshing. What do you think?
I agree. The American Heart Association recently came out with the mind-heart-soul connection statement. And we actually have a paper in press, which is going to be published in the European Heart Journal, which talks about the importance of spirituality in cardiovascular medicine, the mind-heart-soul connection. So stress, everybody is living in a stressful condition, and so like I said, master the mind, exercise the body, and enrich the soul. That's the key message.
Oh, that was really good.
That was really good. I appreciate you both.
I like that.
Dr. Kaura and Dr. Mark, thank you. Speaking of exercise here, still to come on New Day Cleveland, we're talking about when it is safe to start exercising after you've had COVID. We have answers from our team at the Cleveland Clinic just after this. In honor of Cleveland Clinic's centennial year, we celebrate this heart history moment. In 1958, a serendipitous accident occurred when an injection of contrast dye into the coronary artery led to the discovery of coronary arteriography by Dr. Mason Sones. This provided cardiologists accurate pictures of arterial blockages. Welcome back here. 33% of Americans incorrectly believe that you're only at risk of long-term heart health effects from COVID-19 if you've already had a pre-existing heart condition. Keep that in mind. David?
Okay, we know about exercise, right? Exercise is good for our hearts, but for some, COVID has thrown a wrench into fitness programs. Dr. Mark talked with several Cleveland Clinic sports cardiologists about training, getting back to exercise, risk of heart infection, and a whole lot more.
I'm Tamana Singh. I'm one of the co-directors for the Sports Cardiology Center at the Cleveland Clinic.
There's been talk of heart inflammation or myocarditis due to COVID-19.
It's viral invasion of the heart muscle. It basically triggers an inflammatory response. So we typically will use a cardiac MRI to diagnose it. That allows for us to see inflammation within the actual heart muscle. And then there can also be areas within the heart muscle that are affected to a point where there is actual scar that can generate. And so, the ways we typically treat myocarditis, especially from an athletic perspective, is really asking our athletes and people who are really active to keep their exercise very low, to what we call low intensity. So something that is more like yoga, maybe some very kind of slow, short walks, golf perhaps, provided that you're not walking from hole to hole.
The amount of myocarditis in patients has been less than anticipated, but Singh says it's still important to know the symptoms.
Chest discomfort on exertion, some level of exertional intolerance, perhaps just again not feeling like you can breathe like you were before. Those types of red flag symptoms that can allow for us to get a good assessment and see whether or not there's any need to do some investigation.
Dr. Michael Emery is co-director of the Sports Cardiology Center at Cleveland Clinic.
If you had a serious case of COVID, meaning you were hospitalized, then you need to see your medical provider before resuming an exercise program and have a general evaluation. If you were really just mildly symptomatic and didn't have any specific cardiac symptoms such as chest discomfort, shortness of breath, heart palpitations, passing out, then it's a matter of recovering from the initial infection and starting back slow. If you were exercising before COVID, don't think that you can right back in like you never missed a day. Start slow and build yourself up, and if you build yourself up without any of those previous symptoms now developing, such as chest discomfort or shortness of breath or heart racing, then you're probably fine. If you have problems getting back to exercise, those symptoms, or you just can't get back to where you are, that's a good reason to see a provider. Any time is a good time to start to exercise, right? Exercise is one of the absolute best things you can do for your health, longevity, and overall quality of life. So any excuse to start is great. And just starting is often the hardest part. So if you have equipment at home that you can start doing something, that's great. If you go for more walks, that's great. Even if you want to go to a gym, as long as that gym has got appropriate protocols in place, you should be safe. Stopping exercise because you're afraid to go out is probably doing you more harm than it actually is doing you good, because exercise has been shown to increase your immune response and increase your immunity levels when you're exercising at a moderate intensity, which is what we recommend for general cardiovascular health. So keep that up. Exercise is good for you. Find a partner that you can socially distance from and both wear masks, or in your same household that you can continue to exercise, and go for it.
Well, let's talk to Dr. Mark. Yeah, let's talk to Dr. Mark about this, because talk about exercise. A lot of people get a chance to exercise a little bit more. Some people actually fared a little bit better during this thing. But I see a bunch of snow out there too, Dr. Mark. Shoveling snow might not be the best exercise, right?
Shoveling snow for people with heart disease, not the best.
Not the best.
But exercise, I want to say exercise is, I was going to say easy. That's not the right word. Exercise is so available, meaning just walking. Walking is good exercise. And walking up and down stairs is better exercise than walking on level ground. So there are just so many opportunities. In fact, I love a lot of our stairs here at the Cleveland Clinic. Right outside the stairwell, there's a sign that says free exercise equipment. Stairwell is in here. So it's available to you everywhere, no matter who you are, what you do, where you live. Exercise is available, but the biggest problem is always, how do I get started? How do I make myself do it? And I'm a lot like many people. I've got a little list of stuff to do every day. It's like you have a list when you go to the grocery store or something, and on my list every day is take a half hour and exercise. So it's a great thing to put on your list and make sure it's on your list every day, really, really every day.
Depending on your age, Dr. Mark, some people might say, well, I don't know if me walking for 30 minutes is enough, or what constitutes a healthy workout so that my heart stays in check. I know probably different age ranges, it's different, but what would you say to people who might say, well, if I walk for half an hour, is that going to be enough for me?
I think I'd say two things. The first thing is some exercise is better than no exercise. So the big change is going from nothing to something. And then how much is the right amount for each individual? That's going to vary. But we always say a minimum. The minimum is 30 minutes of walking at a good pace every day. What's a good pace? A good pace is you're walking quickly enough that you're having a little trouble talking while you're walking. Like that. You can talk, but you're moving along at a decent clip. Now, if you're more athletic and you're younger and you feel like, hey, I can work up a sweat, that's even better. The exercise and its benefit are dose dependent, meaning the more you do, the better off you are. But just getting going in some way is the big step.
Okay, so I exercise that much. I can barely talk. I get off it. I feel pretty good now. I've rested up. So now I can go out and have those French fries and that greasy burger, right?
Yes.
Yeah, or some people go the other way. They'll say, I had the French fries, the greasy burger, and now I can cancel that out with exercise. And that's not quite true. You know that. That's why I can't see you, but I can see the smile on your face when you said that. Not quite true. A greasy burger every now and then is not going to kill you, nor are French fries. But if that's your daily meal, that will kill you eventually at the end. So pair exercise with the good, healthy, low-processed food, varied diet, and every once in a while you need the burger, have it.
I want to make sure that we do know that there have been a lot of positives that have come with COVID, and some people even fared better when it came to exercising, and we just wanted to show you this to make sure you see. I mean, 32% say that they've exercised more. 30% of folks that were surveyed said they have a healthier diet now. 35% say they've been adding the vitamins and supplements. So there are good things that have come our way, and people really starting to take care of themselves better through COVID. Dr. Mark, we appreciate you. We'll be checking back in with you momentarily here as well, okay?
Okie doke, folks. We'll talk about supplements sometime soon. 3D printing. How about that? It's making heart surgery easier on patients and doctors, and we're going to show you how. The New Day Cleveland Love Your Heart Show will be right back. Half of Americans, 52% and 65% of heart disease patients have put off health screenings or checkups because of the pandemic.
Well, innovations are just incredible these days. 3D printing is helping heart patients feel more confident about the surgery and helping doctors do their jobs better. So Dr. Mark has more on that now.
But that's a liver, two different pieces.
You can think about 3D printing as an advanced platform to display heart images.
Dr. Serge Harb is a cardiologist at the Cleveland Clinic with a subspecialty in cardiac imaging.
Instead of looking at ultrasound, CAT scans, MRIs on a screen, you can combine this data to come up with a model that is an exact anatomic replica of the patient's heart.
Harb gives new meaning to the phrase heart in hand.
That is an actual model of my actual heart. They spent, probably a month or two building it off of all kinds of different imaging.
Russell Moore is a cardiac patient at Cleveland Clinic.
I had my first two heart attacks when I was 25. I had one at 31 and then one at 38. And the last one was roughly about 12 years ago.
Moore's last surgery was to repair a heart valve. Of course, he was concerned.
The moment I walked into the office when I first met him, he was like, wow, you have a real lot going on. And first thing he said to me, he goes, that's all right. He goes, we're going to take care of it. He just gave me that instant, calming effect was, it doesn't matter technology, medicine, science. When you've got a doctor, a person like that, that's like, hey, we're going to take care of this, like treat you like a person, that right there goes farther than anything.
The technology does help, though, both doctor and patient.
First and foremost, it did help Mr. Moore understand his cardiac condition. He came to us and he was told that he had severe leak, but no one explained to him why he had the leak. So the model did help him understand exactly where the problem is and what had occurred. And then also when he met with the surgeon, he had a clear understanding about what's going to take to repair his valve. So he understood it better, he became more comfortable and less anxious about his procedure.
From a surgeon's standpoint, the 3D heart model allows better planning.
Instead of trying on the patient during the procedure, we had the option to try on the model of the patient before the procedure, and we were all prepared. When we presented it to the surgeon, now he knew exactly what happened, where the tear is, exactly the trajectory of the lead, and was able to plan the repair much more carefully and much more in a better way.
I feel a lot better as far as the problems with the low blood pressure and wanting to feel like I pass out. No, I feel 100% better, 100%.
Meanwhile, Moore is spending time with his loved ones, keeping up with his workouts, and looking forward to riding his Harley.
Keep on going. Keep on going as long as I can. I'm a vegetarian. I try to live as healthy as I can. I haven't touched caffeine in about 20, 21 years, so I do my best to try to stay just as healthy as I can, but every day by day by day.
Just incredible, isn't it? It's almost miraculous. We're going to bring in Dr. Mark once again to discuss this more. Dr. Mark, for you, the 3D printing, the robotic technology, what would you say in your specialty has really helped you to navigate through and really come through breakthroughs with heart patients?
It really falls under a broader heading, all these technological advancements, and that broader heading is individualizing care. We've gotten now so many more technologically based options. For example, if somebody has a heart valve problem, we can do regular heart surgery in some people. We can do robotic surgery with a little tiny incision in some people. And then we have experimental therapies where we can fix them with catheters. Some are experimental, some are currently available, and we don't even have to do surgery. The way we choose who gets what is involved with advances in imaging, meaning incredible abilities with CT scans and echocardiography that's now 3-dimensional and CT that are 4-dimensional to basically look inside, reconstruct the anatomy, and know what we're going to do. And 3D printing helps individualize in the same way for pediatric heart surgery, or what we call congenital heart surgery, because many of these babies and small children have extremely complicated, almost one-of-a-kind heart defects. And before repairing them, we want to eliminate surprises, make a good plan, and that's where 3D printing the actual heart from CT scans and echocardiography comes in. So it comes down to improved imaging, improved understanding, leading to better planning, coupled with more options, and altogether that means we can do what's exactly right for you. I mean, I liken it to sometimes you go to a store and they sell shirts in small, medium, and large, and other stores sell a shirt that's exactly your sleeve size, your neck size, your chest size. We want to be like that one, where it fits you, the patient, precisely.
Boy, the evolution of open heart surgery period is amazing. I mean, you must have, it's like you're going to school every day. You know, years ago you went to medical school and you became a surgeon, things keep changing. What's been the most shocking new revelation as an open heart surgeon, not even doing open heart surgery anymore?
The most shocking revelation to me is I don't do anything the way I learned to do it 25 years ago.
Wow.
I mean, nothing is the same. And I see this every day. I have a son who's a first-year medical student at Yale, and he tells me what he learned at school, and then he asks me questions sometimes, or what I think. And what I think is, I didn't know any of that stuff that you just told me because it was not known when I went to medical school. So it's pretty remarkable, the pace of advancement. And it makes it exciting and it makes it rewarding because we're better now than we were last year at this time, and we'll be better next year than we were this year.
They're at the forefront of innovation there.
Fantastic.
I've seen it firsthand. It is incredible. A wealth of knowledge. Always love hearing things like this from Dr. Mark.
You know, it just tells you, take care of yourself and
Yes.
they'll keep taking care of you.
Exactly.
Because if you take care of yourself now, they're going to find a new way next year to take better care of you then. So.
Absolutely. Dr. Mark, don't go anywhere with us. We need you to stick around. We'll have more with him after this short break. But you know, if you've put on a few pandemic pounds, it could also be, oh, I have too. It could also be affecting your health. We don't want that to happen. So coming up, the best diet for weight loss and your heart, and how to make it work for your busy lifestyle.
In honor of Cleveland Clinic's centennial year, we celebrate this heart history moment. In 1960, Dr. Irvin Page, with the help of doctors Helen Brown and Jerome Green, led the National Heart Diet Study, which was founded by the NIH. It ran until 1965 and was the country's first large study that helped establish the link between diet and heart disease.
Welcome back. So you've heard by now of the pandemic 15. Well, it turns out it's more for some of us. 25% of Americans who have gained weight during the pandemic have gained more than 20 pounds.
What can we do to lose some weight? A bunch of stuff. Just eat more heart-healthy way? I don't know. Doctors agree the Mediterranean diet might be the key. Diet Clinic dietitian Kate Patton has some easy tips to incorporate it into our daily lives.
The main components of the Mediterranean diet are eating a lot of plant-based foods. So fruits and vegetables are very important. Eating nuts and seeds, as well as what we call plant-based protein sources. So those would be things like your beans and lentils. So the goal is to try to replace some of the animal protein in our diet and not eat as much, red meat and not as much cheese and dairy, but instead try to work in replacements from natural peanut butter instead of cream cheese, or having a bean burger rather than a beef burger. Oatmeal is a great way to start your day. So oatmeal is going to give you lots of good fiber and whole grains with some protein and some healthy fat too. So we're going to balance that then with adding maybe a little bit more protein and fat. So by adding some nuts and seeds, you can give it a lot of flavor. You don't have to add the sugar. You can add fresh fruit to flavor it naturally. If you like it really creamy, you can use any kind of milk, either lower fat cow's milk or an almond milk alternative. If you're in a hurry, which a lot of us are, you can easily do an overnight oats and soak equal parts oatmeal and equal parts whatever milk or yogurt you like, and then that's nice and soft and ready for you in the morning. Adding seeds like your flaxseed or chia seeds are a great addition to the oatmeal. Yogurt's a great fast morning option too for breakfast. If, for example, your kids aren't into oatmeal, like just good whole grain cereal works just as well. And if, again, they don't like the plain, you can sweeten it naturally with some fruit, or, mix in a little bit of the sweetened cereal with some of the plain cereal to make it more palatable. Other great breakfast could just be, a slice of some whole grain toast with a natural nut butter, or some avocado with whatever kind of seasoning you like. That gives it a lot of extra flavor. As far as lunch, honestly, just Greek yogurt and slivered nuts and fruits, that can be a filling fast lunch, especially if you kind of eat more of the smaller, more frequent meals. Other ways to get in beans pretty easily could be hummus. So, hummus and vegetables and some whole grain crackers, or even, again, if you do more of the small frequent meals, like a trail mix with some nuts and fruit and maybe dry cereal. As far as dinners, so if you do some kind of bean soup or bean and vegetable soup, that's perfect. Chopping some fresh vegetables is always the great way to go. But if you need to use some of the frozen options too, those are perfectly fine. One of my favorite weekend make-ahead meals is roasting a bunch of vegetables, like some yellow and green zucchini, some peppers, carrots, really whatever you like. And then making kind of a baked vegetable ziti. So having some, you make your pasta, mix it with some marinara and your veggies, maybe a little bit of cheese, baking that in the oven, and that's something that can really last throughout the week. But if you're really trying to add the protein, you could try using the bean-based pastas instead.
I love the Mediterranean diet idea. A lot of great healthy food there, sure. But Dr. Mark, how about beverages here? We're talking about any beverages with this Mediterranean diet?
Like wine?
Yeah, that's the question that always comes up, because every one of the charts of the Mediterranean diet, food pyramid, what have you, has over to the side a little glass of wine, a little glass of red wine usually. And the question is that really good for you? That's controversial. It is likely neutral to possibly slightly good to have a little bit of alcohol periodically. What does that mean? Maybe a glass of wine a day, no more. And there are some theoretical benefits. Alcohol could be good. Alcohol reduces blood clotting, and blood clotting is part of heart attacks. Alcohol also increases HDL, the so-called good cholesterol. So there's a little bit of science behind it. When you, though, go beyond your 1 or perhaps 2 glasses, then you cross a threshold such that alcohol begins to be bad for you, causing liver disease, pancreatic disease, dementia down the road, even heart disease. So, short answer, a little bit of alcohol is compatible with a very good heart-healthy life.
Dr. Mark, what if someone has for years had, you know, they love the fried foods or the chips and the candy, and they've had those types of things frequently. Can you reverse and change anything that you might have caused in regards to your health by switching over to something like this diet? Or is there a point where it's too late at this point in time?
It's never too late. You can absolutely improve your health by improving your diet. And if you've been eating fried foods and French fries and chicken fingers for the last 20 years, and today you decide this is the day, I'm switching, you will begin to get healthier very quickly. If you're overweight and you lose weight, and let's say you've got diabetes and you're overweight, you lose weight, that diabetes may go away. Same with high blood pressure. Controlling high blood pressure in the overweight person includes losing weight and exercising. You may get off those annoying blood pressure pills. So absolutely never too late to get better at this and improve your health.
I know they talk a lot about when you go to buy food, you should look at the label, learn how to read the labels on the can, on the box, whatever, to know what's in there so you know what you're putting in your body. But it's a little funny when you go to the fish counter, there's no label on my fish. So what do you do about fish and mercury and that kind of thing? Is that important?
It used to be more important than it is today. Mercury content in fish is very, very low. There are a couple of fish that have been known to have more mercury. Those are tilefish, mackerel, shark. Not fish that I've actually had personally, but even with those fish, the mercury content is very, very low. So fish 2 or 3 times a week is a very, very good idea.
Okay, so now we're approaching this part of the show that everyone's been waiting for.
Yes.
Coming up, that's right. Your heart questions are going to be answered live by Dr. Mark. That's when we come back.
In honor of Cleveland Clinic's centennial year, we celebrate this heart history moment. In 1996, former Cleveland Clinic CEO Dr. Toby Cosgrove pioneered the world's first minimally invasive heart surgery. Just a few years later, Dr. Cosgrove standardized repairing mitral valves versus replacing them. This means better outcomes and fewer complications for patients.
32% of Americans and half of the heart disease patients have experienced concerning health issues since the pandemic started. Well, Dr. Mark is here to answer heart health problems, questions, and some of the non-COVID health issues that people are dealing with due to the pandemic.
Yeah, you know, we wanted to hear what you had to say about this and what you wanted Dr. Mark to answer. So, Dr. Mark, what are some of the things that you're seeing that people are coming in with that are health-related issues that have nothing to do with COVID-19?
Well, one of the biggest is the increase in mental health issues, anxiety, depression, feelings of isolation. I think probably almost everyone has had some measure of these sorts of sentiments or feelings in the last many months. It's just not natural to be isolated. And I mean, I can't see you. It was more fun to come to the studio, and I look forward to it.
We miss you.
It will be a lot of fun, but I mean, that's just one tiny example of the way life has changed, and we all know it, and it's become trite to talk about it. But people ought to do something about it. Plan a call with your friends. Go for a socially distanced walk. You know, with your immediate family, your own little pod. Do things. Stay engaged. There are lots of things people can do. I know one of my kids in college has had movie night with friends where they all watch the same movie simultaneously on television or a streaming service, and while they're on a Zoom call. So there are ways to do it, and even just planning these activities with friends, family, loved ones can help allay some of the anxiety and depression and make you feel like it's a bit normal. But I think the toughest thing would be just to ignore that and try to power through it, because I mean, you can't sprint a marathon, and this is like 10 marathons, one after the other after the other.
Yeah, I think, you know, in addition to that, it's a good idea maybe just jump in the car, drive somewhere where you can get out of the car, walk around a little bit, a little change pace, a little change of scenery. It really cheer you up, make you feel better, and you're getting that exercise we're talking about. And on top of that, you know, we're talking about, this is a heart show, so we're talking about heart patients. The vaccine, the COVID vaccine, if somebody has a heart problem, should they get the vaccine? If somebody's had a heart repair, should they get the COVID vaccine? Where does that fall?
That's an easy one. Yes, yes, yes. Everyone should get the vaccine. Everyone should be considered for the vaccine. You're not just protecting yourself, you're protecting everyone else in society, you're protecting your relatives, your friends. If you can get the vaccine, if it's available to you, definitely get it. No question about it.
Dr. Mark, Jack also emailed us and said, he asked about dizzy spells, and he asked if they are an issue for heart patients because maybe he's experiencing them, so he wants to know that he's okay. So is that an issue?
The question with dizzy spells or syncope, fainting, those are all the same thing. Syncope is the medical term for an actual fainting episode. The question there is, what caused it? And there are a lot of causes. The most common is what's called a vasovagal reaction. You stand up quickly and you faint, or you have a sudden emotional event and you faint. And those are relatively harmless in the sense they don't need treatment. But heart problems can cause dizzy spells and fainting, like abnormal heart rhythms termed arrhythmias. So if you have a fainting spell, it's worth getting it investigated. See your doctor, get an EKG. In all likelihood, it will turn out to have been nothing important. But if it is something that requires treatment, you want to have that in hand and get treated before, let's say, you have another one while you're walking up the stairs.
So trying to make a point on some of these things, we talk about them a lot, but people keep asking about them, so you have to keep pounding that nail into the wood. We're talking about like blood pressure. What should your blood pressure be? What should your cholesterol be? People ask those questions over and over again. Have the answers changed?
We do change the answers, meaning the cardiologists and heart doctors, we change the answers from time to time as we write new guidelines, and the guidelines are based on increased understanding and research. But basically, what do I want my blood pressure to be? I want it to be around 120/80, perhaps a little bit less or just a little bit more, but 120/80, that's what I want to shoot for. Cholesterol. I don't actually care about my total cholesterol. I want to know my LDL cholesterol first. LDL is the so-called bad cholesterol. LDL cholesterol is the one that, when that's up, increased risk of stroke and heart attack. I want my LDL less than 130. The other number I'd like to know is my HDL. HDL is the good cholesterol. I want that as high as possible. That's a little tougher to manage, but exercise increases your HDL. If you get a cholesterol test, though, look at those two numbers. What's my LDL? What's my HDL?
Dr. Mark, we have about a minute left in show, and one of our viewers wanted you one more time to go over heart attack signs.
Heart attack signs. Number one, chest pain. And it's usually not a sharp pain, it's more like a pressure. Someone says it feels like an elephant sitting on my chest, or it feels like squeezing. When someone says I have chest issue and they go like this, that's a heart attack. So chest pain is number one. In addition, shortness of breath, nausea and vomiting, pain down the left arm, pain up the neck, pain in the back. And this comes up as well. Is it different in women? Do women have different signs? Chest pain is still number one in women, but women can have a little bit more nuanced or subtle signs, like I just don't feel right for the last couple of days. But still, chest pain, chest pain, chest pain. That's 1, 2, and 3. If it's chest pain, think heart.
Thank you, Dr. Mark. We appreciate you, your wealth of knowledge. I think hopefully we hope to save some lives today too.
You know, we do this every year. We do this show, and it's such an important show to do because, as Dr. Mark said, things change. Things change by every month in the medical field, and we're talking about your heart, and you know, your heart has to be healthy if you want to have a great life.
We hope you've enjoyed the show today. Thank you for joining us.
Thank you. So long.